Doctors once diagnosed illnesses by tasting urine, and sometimes they'd drill a hole into a person's skull while they were awake to supposedly release evil spirits. People in the Dark Ages also used animal dung in their medicines. And if you had a persistent fever, they might just decide to bleed you with leeches or a sharp knife. Some believed that plants looking like body parts could cure those very parts, and your chances of surviving surgery were terrifyingly low. Number 15. When plants looked like your insides, they became medicine. Imagine looking at a plant with liver-shaped leaves like liverwort and thinking, "Aha, this must be good for my liver." This was the core idea behind something called the Doctrine of Signatures. It was a philosophy suggesting that a divine creator had left clues, or signatures, in plants, animals, and minerals indicating their medicinal uses. If a plant resembled a human organ or a symptom of a disease, it was believed to be a remedy for that specific ailment. So walnuts, with their brain-like appearance, were thought to be good for brain health. Eyebright, a delicate flower with markings that somewhat resembled an eye, was used for eye conditions. Lungwort, with its spotted leaves looking a bit like diseased lungs, was prescribed for pulmonary issues. This system wasn't entirely exclusive to the Dark Ages, with roots in ancient times and continuing for centuries, but it was a significant part of the medical understanding during this period. People weren't just randomly picking plants, they were actively looking for these divine hints. The shapes, colors, textures, and even the environments where plants grew were all considered potential signatures. For instance, plants with yellow flowers or sap like celandine were often used to treat jaundice, a condition that turns the skin yellow. Plants that were jointed like some horsetails were thought to be beneficial for joint problems. This wasn't about chemical analysis, it was about pattern recognition guided by a deep-seated belief in a purposeful, divinely ordered natural world. While some of these remedies might have coincidentally contained beneficial compounds, the primary reason for their use was this perceived resemblance. It provided a framework, a way of trying to understand and categorize the vast botanical world for healing purposes when scientific methods were still far in the future. It was a system based on analogy and faith, a testament to humanity's enduring quest to find order and meaning in the natural world to combat suffering. Number 14. Going under the knife, wide awake. Picture this. You have a badly broken leg that needs setting, or perhaps a painful bladder stone that needs to be removed. Now imagine undergoing the operation with no modern anesthesia to numb the pain. This was the grim reality of surgery in the Dark Ages. While surgeons of the time possessed a surprising amount of skill in certain procedures, their patients endured unimaginable agony. Concept of general anesthesia, which renders a patient unconscious and insensible to pain, simply didn't exist as we know it. Surgeons had to work incredibly fast to minimize the duration of suffering. Speed was valued as much as precision, if not more. Patients were typically held down by several strong assistants. To manage the pain, if anything was used at all, it might be alcohol, like wine or strong spirits to dull the senses, or perhaps opium, if available, though its effects were variable and not fully understood. Some practitioners used herbal concoctions like mandrake root, henbane, or hemlock, which had soporific, sleep-inducing, or analgesic, pain-reducing properties. However, these substances were dangerous. The line between a dose that induced stupor and one that was lethal was very fine. Often, patients were given a piece of wood or leather to bite down on to prevent them from biting their tongues or screaming too loudly. Common surgical procedures included amputations, necessitated by severe injuries or gangrene. Surgeons would use saws, knives, and chisels. Cauterization, Burning the wound with a hot iron was often used to stop bleeding after an amputation, adding another layer of trauma. Repair in hernias, removing bladder stones, a procedure called lithotomy, and treating severe wounds were also undertaken. The survival rates were, as you can imagine, not high. Infection was a massive killer, as germ theory was, centuries away. Without understanding the need for sterile instruments or environments, even a technically successful operation could lead to a fatal infection days later. Courage of both the patient and the surgeon in these circumstances is hard to comprehend. Number 13. Childbirth, a dance with death itself. For women in the Dark Ages, childbirth was an incredibly dangerous event, often referred to as a little death. While a natural process, the risks of complications, infection, and maternal or infant mortality were alarmingly high. Medical assistance was primarily provided by midwives. Women from the community who had experience often passed down through generations. Their knowledge was a mix of practical skill, herbal remedies, and a heavy dose of local folklore and superstition. Male physicians rarely attended births unless there were severe complications and the family was wealthy or of high status. Childbirth was largely considered women's domain. The environment for birth was usually the home, which was not necessarily clean by modern standards. Practices varied, but hygiene was not a priority because the concept of germs causing infection was unknown. Midwives used their hands, and perhaps some basic tools, if absolutely necessary, but intervention was often risky. If a labor was prolonged or obstructed, the options were limited and often harrowing. Forceps were not yet in common use, and procedures like a cesarean section were almost exclusively performed post-mortem to try and save the baby if the mother had died, or were incredibly rare and usually fatal for the mother if attempted on a living woman. Superstition played a significant role. Special prayers, amulets, and charms were often employed to protect the mother and child and to ease labor. Certain saints were invoked for assistance. It was believed that knots in the room should be untied and doors unlocked to symbolically open the way for the baby. After birth, both mother and infant remained highly vulnerable. Puerperal fever or childbed fever, a severe infection of the mother's reproductive organs, was a common and often fatal complication. Infant mortality rates were also staggering, with many babies not surviving their first few weeks or months due to illness, infection, or congenital issues for which there was no treatment. Despite the dangers, midwives were crucial figures, offering support and care with the knowledge they possessed, navigating one of life's most critical moments with bravery and resilience. Number 12. When madness meant demons were lodging in your head. Mental illness in the Dark Ages was a profoundly misunderstood and often terrifying condition, both for the person suffering and for the community around them. Prevailing belief was that mental disturbances, what we might now recognize as conditions like schizophrenia, bipolar disorder, severe depression, or epilepsy, were not caused by biological or psychological factors, but by supernatural forces. Demonic possession was a common explanation. It was thought that evil spirits could invade a person's body and mind, causing them to behave erratically, speak in strange tongues, or exhibit unusual strength or agitation. Consequently, the treatments were often spiritual rather than medical. Exorcism was a primary approach, performed by priests or other religious figures. These rituals involved prayers, holy water, the use of relics, and commanding the supposed demon to leave the afflicted person. If spiritual interventions failed, or if the person's behavior was particularly disruptive or violent, more drastic measures were taken. Individuals deemed mad were often isolated from society. They might be confined to their homes, locked in cellars or outbuildings, or even abandoned in remote areas. In some cases, institutions began to emerge, such as sections of monasteries or early forms of asylums, but conditions in these places were generally appalling. Restraint was common. Patients might be chained to walls, bound in straitjackets, or confined to small cells. Physical treatments were also employed, sometimes with the intention of driving out the supposed evil spirit or calming the patient through exhaustion or pain. These could include beatings, whippings, submersion in cold water, a form of shock therapy, or induced vomiting and purging. The idea was that such harsh measures might make the body an inhospitable place for the possessing entity. There was little concept of compassionate care or understanding of the underlying causes of mental distress. While some individuals might have received kinder treatment from family or within monastic settings that offered peace, the general approach was one of fear, containment, and often cruelty, born out of a lack of scientific understanding and a ware louve heavily influenced by religious interpretations of suffering and evil. Number 11. The tiny worm blamed for your toothache. Got a throbbing toothache in the Dark Ages, and indeed for centuries before and after, a very common explanation was the tooth worm. People genuinely believed that a tiny worm gnawed away at the tooth from the inside, causing decay and excruciating pain. This wasn't just a quaint folk belief. It was a widely accepted theory among many who practiced healing. Illustrations from the period sometimes even depicted these little worms. So, how did they try to get rid of this phantom pest? Treatments were varied and often quite inventive, if not effective, against a non-existent worm. One common method was fumigation. The sufferer would inhale smoke from burning henbane seeds or other strong-smelling herbs. The idea was that the noxious fumes would either kill the worm or drive it out. Sometimes after such a procedure, small particles, perhaps charred seed fragments or bits of debris, would be found, and these were triumphantly declared to be the expelled worms. Another approach involved applying various concoctions directly to the aching tooth. These might include mixtures of herbs, spices, and sometimes less savory ingredients like crushed insects or even mouse droppings, all thought to have worm-killing properties. If the pain was unbearable and conservative treatments failed, extraction was the last resort. Tooth pulling was often performed, not by specialized dentists, but by barbers, barber surgeons, or even blacksmiths, using rudimentary pliers or forceps. This was, of course, done without anesthesia and was a brutal, painful ordeal, often resulting in broken teeth, fractured jaws, or severe infections. The belief in the toothworm persisted for a surprisingly long time because it provided a tangible explanation for an invisible ailment. The pain was real, and the idea of a physical creature causing it made a certain kind of sense in a world without microscopes or a deep understanding of bacteriology. While we now know that tooth decay is caused by bacteria, the image of the toothworm remains a fascinating example of how people tried to make sense of suffering with the knowledge available to them. Number 10. Your health chart was written in the stars. In the Dark Ages, looking up at the night sky wasn't just for navigation or wonder. It was also considered essential for understanding and treating human health. Astrological medicine, or iatromathematics, was a significant and widely accepted part of medical practice. Core belief was that the movements and positions of the stars and planets had a direct influence on the human body, its functions, and its susceptibility to disease. Each part of the body was thought to be governed by a specific zodiac sign. For example, Aries ruled the head, Taurus the neck, Gemini the arms and shoulders, Leo the heart, and so on down to Pisces ruling the feet. Similarly, the planets were associated with different qualities and organs. Mars, being the god of war, was linked to fevers, inflammation, and surgery, while Venus was associated with the reproductive organs and gentle healing. Physicians, or those practicing healing, would often consult astrological charts before making a diagnosis or deciding on a course of treatment. Timing of medical procedures was considered crucial. Bloodletting, for instance, would ideally be performed when the moon was in a favorable sign and aspect, and certainly not when it was in the sign ruling the part of the body being treated. Collecting herbs for medicines was also timed according to astrological configurations, as it was believed that plants gathered under specific celestial influences would be more potent. A doctor might cast a patient's horoscope, a chart based on their birth date and time, to understand their inherent constitution, their vulnerabilities to certain illnesses, and the likely course of a disease. This astrological diagnosis would then inform the prescribed remedies, which might include herbal concoctions, dietary changes, or specific activities, all aligned with favorable planetary energies. This wasn't seen as superstition by many at the time, but as a sophisticated science that connected the microcosm of the human body with the macrocosm of the universe. University-trained physicians were often well-versed in astrology, and medical almanacs containing astrological information were common. It was a holistic view, where human health was inextricably linked to the cosmic order. Number 9. When animal poop was a prescription. It might sound repulsive to us today, but in the Dark Ages, animal dung was a surprisingly common ingredient in medical remedies. This wasn't just a desperate, last-ditch effort. Various types of animal excrement were listed in medical texts and formularies for treating a range of ailments. Practice known as stercus medicinale, or medicinal dung, had roots in ancient Egypt and Greece and persisted through the medieval period. Different types of dung were believed to have different properties. For example, the dung of dogs that had been fed bones, known as album graecum, or white Greek, was often used externally as a poultice for sore throats or to help dry out wounds. Pigeon droppings were sometimes recommended for epilepsy or baldness. The dung of goats, sheep, or cows might be mixed with other ingredients like honey or wine and applied to swellings, burns, or skin diseases. Some remedies even called for fresh, warm dung to be applied directly to the affected area. The rationale behind these treatments vary. Sometimes it was based on the idea of sympathetic magic, for instance. A substance that dried quickly, like dried dung, might be thought to help dry out a weeping wound. Other times it might have been linked to the perceived properties of the animal itself. Perhaps the dung of a strong animal was thought to impart strength. There might also have been an element of like cures like, or conversely, that a foul substance could drive out a foul disease. While largely ineffective and certainly unhygienic by modern standards, there's a tiny sliver of possibility that some types of dung might have inadvertently contained substances with mild antibiotic properties, like certain molds, though this would have been purely coincidental and unreliable. More often, applying dung to open wounds would have introduced harmful bacteria, greatly increasing the risk of serious infection. Yet in a time with limited understanding of disease and a desperate need for cures, people turned to the resources available in their environment, and animal excrement was readily available. It's a stark reminder of how different the approach to medicine was, driven by observation, tradition, and a willingness to try almost anything to alleviate suffering. Number 8. Curing sickness with a saint's big toe, or other bits. In an age dominated by faith, the line between spiritual and physical healing was often blurred, and sometimes entirely erased. One of the most prominent forms of medical intervention, if one could call it that, was healing through holy relics. These were physical remains of saints, bones, hair, teeth, or even dust from their tombs, or objects that had come into contact with a saint, such as pieces of their clothing or items they had used. It was widely believed that these relics possessed miraculous healing powers, imbued by the saint's holiness and their closeness to God. People suffering from all manner of illnesses from fevers and blindness to paralysis and mental afflictions, would undertake arduous pilgrimages to shrines that housed important relics. Famous pilgrimage sites like Santiago de Compostela in Spain, Canterbury in England, or various sites in Rome attracted vast numbers of the sick and disabled, all hoping for a cure. The process of seeking healing could involve touching the relic, praying before it, or even consuming water or wine in which a relic had been dipped. Sometimes, elaborate rituals were performed by priests or custodians of the relics. The belief was so strong that countless stories and testimonies of miraculous cures circulated, further reinforcing faith in the power of relics. Churches and monasteries vied to possess the most potent relics, as they brought prestige, pilgrims, and donations. This led to a thriving and sometimes dubious trade in relics, with forgery and misattribution being common. A single saint might have multiple heads or an impossible number of limbs, scattered across various shrines. Beyond the direct interaction with relics, faith healing also encompassed prayers, vows, and the intercession of saints. People would pray fervently to their patron saint or to saints known for healing specific ailments: Saint Roch for plague, Saint Lucy for eye problems, Saint Blaise for throat afflictions. While from a modern medical perspective, the efficacy of relic healing would be attributed to the placebo effect or spontaneous remission, for people in the Dark Ages, it was a vital and often primary source of hope and a testament to their profound religious convictions. Number 7. Sealing wounds with a sizzling hot iron. Imagine having a wound that wouldn't stop bleeding, or a growth that needed to be removed. In the Dark Ages, before sophisticated surgical techniques or understanding of infection, one of the most dramatic and widely used methods to deal with such problems was cauterization. This involved applying extreme heat, usually from a red-hot piece of metal, directly to the affected tissue. The primary purpose of cautery was to stop bleeding, hemostasis, by searing the blood vessels shut. In a time before effective ligatures tying off blood vessels were commonly or skillfully used, especially in battlefield situations or during amputations, cauterization was a brutal but often life-saving, albeit agonizing, measure. Specialized cauterizing irons came in various shapes and sizes, designed for different purposes: flat ones for surface wounds, pointed ones for deeper application, or even hollow ones to protect surrounding tissues. The surgeon would heat the iron in a brazier or fire until it glowed red, and then quickly apply it to the bleeding wound or the tissue to be destroyed. The smell of burning flesh, the sizzle, and the patient's screams, as this was done without effective anesthesia, would have been terrifying. Beyond stopping bleeding, cautery was also used to destroy diseased tissue, such as cancerous growths, though their understanding of cancer was rudimentary, warts, or infected flesh. It was believed that the intense heat would burn out the sickness. It was also sometimes used as a counter-irritant, deliberately creating a burn in one area to supposedly draw out bad humors or pain from another part of the body. While effective at stopping hemorrhage, cauterization was a double-edged sword. It caused immense pain and significant tissue damage, creating large burn wounds that were themselves highly susceptible to infection. The resulting scars could be severe and debilitating. However, in a medical landscape with few alternatives for controlling catastrophic bleeding or removing problematic tissue, cauterization, despite its horrors, was a tool that surgeons relied upon heavily. It represented a desperate, forceful intervention against disease and injury. Number 6. When blood-sucking leeches were your doctor's best friend. If you went to a healer in the Dark Ages with almost any complaint, a fever, a headache, a swelling, even general malaise, one of the first treatments you might encounter involved leeches. Herodotherapy, or leech therapy, was an incredibly common medical practice, deeply intertwined with the prevailing theory of humors. This theory, inherited from ancient Greek physicians like Hippocrates and Galen, posited that the human body contained 4 essential fluids, or humors: blood, phlegm, yellow bile, and black bile. Health was maintained when these humors were in perfect balance. Illness arose when one or more humors became excessive or corrupted. Leeches were primarily used for bloodletting, a procedure aimed at removing excess or bad blood, thereby restoring humoral balance. The medicinal leech, typically Hirudo medicinals, was the preferred species. These creatures have 3 jaws with tiny teeth and produce an anticoagulant called hirudin in their saliva, which prevents blood from clotting and allows them to feed efficiently. A physician or barber surgeon would apply the leeches to the patient's skin, often near the site of the ailment or on specific points believed to be connected to certain organs. The leeches would attach themselves, make a small incision, and begin to draw blood. Each leech could consume several times its own weight in blood. After they were engorged, they would detach naturally, or they could be encouraged to do so with salt or vinegar. The number of leeches used and the frequency of application varied depending on the perceived severity of the illness and the patient's constitution. While this practice might seem bizarre today, it was considered a sophisticated medical intervention. Leeches offered a more controlled and sometimes gentler way of bloodletting compared to venesection, cutting a vein. They were used for an astonishingly wide array of conditions, from inflammatory diseases and infections to mental disorders, and even to prevent illness. Collecting and selling leeches became a specific trade. The demand was so high at times that leech populations in some areas were depleted. While often debilitating and based on a flawed theory, the use of leeches persisted for centuries, a testament to the enduring power of established medical doctrine. Number 5. Your pee was a window to your health, sometimes by taste. Imagine your doctor, instead of ordering lab tests, carefully examining a flask of your urine, noting its color, clarity, sediment, and even its smell, and yes, sometimes its taste. This practice, known as uroscopy or urine gazing, was a cornerstone of medical diagnosis in the Dark Ages and for a long time afterward. Physicians believed that urine was a direct filtrate of the blood and thus provided crucial information about the state of the body's humors, blood, phlegm, yellow bile, and black bile, and the overall health of the patient. Specialized urine charts, often circular and very detailed, were developed. These charts depicted various colors of urine, from pale straw to deep red or even black, each associated with specific imbalances or diseases. For example, reddish urine might indicate an excess of blood or problems with the liver, while white, thick urine could suggest an excess of phlegm. The physician would hold the flask of urine, often a special clear glass vessel called a matua, up to the light, meticulously observing its characteristics. They would note the consistency, whether it was thick, thin, or frothy. They would examine any sediment, its type, and where it settled in the flask. The smell was also considered important. A foul odor might indicate putrefaction or a serious internal issue. And then there was the taste. While not universally practiced by all physicians for every patient, some medical texts did describe the diagnostic significance of tasting urine. For instance, sweet-tasting urine, which we now know is a sign of diabetes mellitus, mellitus means honey sweet, was recognized even then as a specific indicator. Uroscopy was considered such an important diagnostic tool that the matula became a symbol of the medical profession, much like the stethoscope is today. Patients would send samples of their urine to physicians for diagnosis, sometimes from great distances. While the interpretations were based on the flawed humoral theory, the careful observation involved in uroscopy sometimes did lead to astute, if coincidentally correct, assessments of certain conditions. It represented a non-invasive way to try and understand what was happening inside the body, using the information that was visibly and sensorially available. Number 4. A hole in your head to let the bad stuff out. If you suffered from severe headaches, seizures, or what was considered madness in the Dark Ages, one of the more alarming treatments you might face was trepanning. This involved drilling, cutting, or scraping a hole into the skull of a living person. The rationale behind this dramatic procedure was often to release perceived pressure, or evil spirits believed to be causing the ailment. In an era where understanding of brain function and mental illness was minimal, and supernatural explanations for suffering were common, trepanning offered a direct physical intervention. It was thought that by creating an opening in the skull, malevolent demons, bad humors, or built-up pressure could escape, thereby relieving symptoms like excruciating migraines, epileptic fits, or erratic behavior. Procedure was performed by surgeons, barber surgeons, or sometimes even individuals with a local reputation for such skills. Tools were rudimentary. Simple hand drills, saws, or sharp scraping implements made of metal or even flint. Patient would be conscious, likely restrained, and would have to endure unimaginable pain, as effective anesthesia was non-existent. The surgeon would carefully work through the layers of scalp and bone, attempting to avoid damaging the delicate brain tissue underneath. Sometimes a circular piece of bone, known as a roundel, was removed. Archaeological evidence in the form of trepan skulls, some showing signs of healing around the edges of the hole, indicates that not everyone died from this procedure. Survival meant the patient lived through the initial operation and managed to avoid fatal infection, which was a huge risk given the lack of sterile conditions. Trepanning wasn't solely for spiritual or mental issues. It was also used for treating skull fractures, to remove bone splinters, or relieve pressure from bleeding caused by head injuries. While terrifying to contemplate, the existence of healed, trepanned skulls suggests that some practitioners possessed a degree of anatomical knowledge and skill, and that the human body, even then, sometimes had a remarkable capacity to survive extreme interventions. It remains one of the most visually striking and unsettling medical practices of the past. Number 3. Feeling sick? They'd probably just bleed you. Bloodletting, also known as phlebotomy, was arguably the most common medical treatment for almost any ailment in the Dark Ages, and its popularity persisted for centuries. Whether you had a fever, an infection, a headache, pneumonia, or even felt a bit melancholic, the chances were high that a physician or barber surgeon would recommend letting some of your blood. Practice was rooted in the ancient Greek theory of the 4 humors: blood, phlegm, yellow bile, and black bile. Health was believed to depend on these humors being in balance. Sickness was thought to occur when one or more humors were excessive or corrupted. Since blood was considered the most dominant humor and often implicated in imbalances, removing a quantity of it was seen as a direct way to restore equilibrium. There were 2 main methods of bloodletting. Venesection involved cutting into a vein, typically in the arm, at the elbow, the median cubital vein, using a sharp instrument called a lancet. The amount of blood removed could vary significantly from a few ounces to several pints, sometimes leading to fainting or severe weakness. Special charts often incorporating astrological information guided practitioners on the best veins to open for specific conditions and the most auspicious times for the procedure. The second method was arteriotomy, which was less common and more dangerous, involving cutting an artery usually at the temples. Another approach, often considered a form of bloodletting, was cupping, where heated glass cups were placed on the skin to create suction, sometimes after making small incisions to draw blood. Leeches were also widely used for a more localized bloodletting. The perceived benefits were numerous. It was thought to reduce fever, calm inflammation, relieve pain, and expel bad or plethoric excessive blood. Physicians carefully observed the quality of the blood being drawn, its color, consistency, and whether it clotted quickly, as these characteristics were also believed to offer diagnostic clues. While based on an incorrect understanding of physiology and often harmful weakening already ill patients, bloodletting was a deeply entrenched medical tradition performed with conviction and considered a vital therapeutic intervention for a vast range of human suffering. Number 2. Magical plants and mysterious concoctions. Herbalism. The use of plants for medicinal purposes was a central pillar of healthcare in the Dark Ages, but it was a practice deeply interwoven with folklore, magic, and religious beliefs, making it a bewildering world of remedies. While many plants do contain pharmacologically active compounds, and some traditional herbal remedies were undoubtedly effective for certain conditions, the understanding of why they worked was often far removed from modern science. Knowledge of medicinal plants was preserved and developed in monastic gardens, where monks cultivated herbs for healing and also passed down through generations of lay healers, often women, in local communities. These healers possessed extensive practical knowledge of local flora. However, the selection and preparation of herbal remedies were frequently governed by principles other than just the plant's physical properties. The Doctrine of Signatures, for example, suggested that a plant's appearance gave clues to its use. Astrological considerations were also paramount. Herbs were often gathered at specific times of the day or night, or under particular planetary alignments to maximize their potency. Incantations, prayers, or charms might be recited during the collection or preparation process, believing that these rituals imbued the herbs with special healing power. The remedies themselves could be complex concoctions, often involving multiple plant ingredients, and sometimes animal products or minerals. Some recipes were straightforward infusions or poultices. Others called for bizarre or unsavory additions based on sympathetic magic or the idea that a potent or repulsive ingredient could drive out disease. For instance, a plant known to cause sweating might be used for fevers, with the logic that it expelled the illness through perspiration. While some herbal treatments, like willow bark containing salicin, a precursor to aspirin for pain and fever, or foxglove containing digitalis for heart conditions, though its use was highly risky due to toxicity, had genuine physiological effects, many others were ineffective or even harmful. The world of Dark Ages herbalism was a fascinating mix of empirical observation, spiritual belief, and a desperate search for cures in a time of limited scientific understanding, where the magical and the medicinal were often one and the same. Number 1. When God was the ultimate diagnostikian via torture. In the Dark Ages, when the lines between law, religion, and medicine were often indistinct, a truly astonishing method sometimes used to determine guilt, innocence, or even divine judgment regarding health or witchcraft was the trial by ordeal. While not a medical practice in the sense of treatment, it could be seen as a form of divine diagnostic, particularly in cases where illness or misfortune was blamed on supernatural causes, like bewitchment. The underlying principle was that God would intervene to protect the innocent by performing a miracle. If a person was accused of a crime, including causing harm or illness through witchcraft, they might be subjected to an ordeal. Common forms included trial by fire, where the accused had to carry a red-hot iron for a certain distance or walk over hot plowshares. Their hand or feet would then be bandaged, and after a set period, often 3 days, the wound would be examined. If it was healing cleanly, it was taken as a sign of God's favor and innocence. If it was festering or infected, it indicated guilt. Another form was trial by water. In trial by cold water, the accused, often bound, was thrown into a river or pond that had been blessed. If they sank, they were considered innocent and hopefully rescued before drowning, as the pure water had accepted them. If they floated, it was believed the water had rejected them due to their guilt. Trial by hot water involved retrieving a stone from a cauldron of boiling water. The subsequent healing or festering of the burn determined the outcome. These ordeals were terrifying, painful, and highly arbitrary. The outcome often depended more on the severity of the ordeal, the individual's resilience, or even the way the wound was bandaged and cared for rather than any divine intervention. In cases where unexplained illness struck a community or livestock and witchcraft was suspected, an ordeal could be used to identify the supposed culprit. If the accused failed the ordeal, they were deemed responsible for the affliction. This practice highlights a worldview where divine judgment was sought for earthly matters and physical endurance, or the random course of wound healing, was interpreted as a direct message from God, bypassing any need for rational investigation or medical diagnosis in such instances.